Good afternoon, everyone. Thank you for joining today's webinar. I'm Fiona Schaefer, Innovation Commercialisation Manager from InnoScot Health, covering the southeast of Scotland. And I'm joined by my counterpart covering the west of Scotland, Francis Ramsey. He's going to help with questions shortly. We run these regular webinars on the last Wednesday of every month, and they focus on a range of different topics, common interest themes in relation to innovators, innovation in this healthcare space. So today we're focusing on inspirational women innovating in the health arena, following on from the International Women's Day earlier this month. So I'm delighted we're joined by Dr. Claire Ann Banga, and she's going to share some of her journey setting up eMoodie. And just by way of housekeeping, today's session is being recorded, and you can find all of our previous sessions via our website on our InnoScot YouTube channel. If you do have any questions during today's session, do put them in the chat, and Francis and colleagues will pull those together and we can address those at the end. So I'm Fiona Schaefer. We've got Dr. Claire Ann Banga joining us today, and Francis is going to help with the question and Q&A at the end. It's very much about giving you good examples, and hopefully will inspire you to come and be the next female innovators. Around 80% of NHS staff are women, so not too surprisingly, we've got some good examples I'm going to shortly share with you before going on to hearing our main speaker today from eMoodie. So a little bit about InnoScot Health for those of you who are not familiar with us. We have been a key part of health tech ecosystem in Scotland for over 20 years now. Initially set up by the Scottish Government in 2002 to support NHS and to act as a tech transfer office to identify, protect and commercialise intellectual property from within the NHS. And over the years, we've worked in collaboration with academia and industry to bring those technologies from within the NHS, or developed in collaboration often with academia as well, into the marketplace, and generating revenue and generating impact. And we have been engaging right through the development pathway end to end, engaging with innovators at any point of the development pathway, whether it's an early stage of a process conceptually or further down, having prototypes and started to do research in a particular area. And, depending on what stage that comes at, we bring expertise in, evaluation, market analysis, health economic and budget impact analysis as well. And we, very much offer that comprehensive support across the full product development lifecycle, including assistance with regulatory compliance pathways for medical devices, which that consultancy has been building up over the last few years. So we're now able to also operate more widely than being just supporting NHS staff, although a lot of our innovation examples and case studies are still those members of the team that we've been working with more closely. But we're now able to work with NHS organisation that's under contract with us, and we've expanded our offering to also non-NHS clients. That could be innovators, startups, other partners, not just in the UK, but internationally. And also we're working on the expansion of sort of different forms of consultancy, building on that, not just in regulatory affairs, but also commercialisation training, investment readiness and things like that. So more information is available on that in our website. So I'd like to just sort of start off. This is going to be quite brief examples of some of the innovators we've worked, female innovators, we've worked with. Gillian Taylor was a nurse based in NHS Lanarkshire, came up with the idea to add scales to patient transfer board slides. And although many people will have had that idea, she was very persistent in actually working we worked with her, we brought in a product design company to create the prototype, and then we're able to protect the intellectual property in that, go then out to potential manufacturers. Licensing partner is Marsden's, who are specialists in weighing devices, and they has now successfully, I think you can see the corner of that picture, it's a bit small, that Gillian's standing with the board itself. And it's essentially makes it very easy to weigh as you're transferring patients, actually be able to weigh them rather than put them in when you've got sick patients, especially with increasing importance of very accurate drug dosing. Having a reliable nurse who's good at guessing the weight of a patient can be a thing of the past. So, and that's successfully, I think around 70% or more of hospitals and trusts have now got these in place. Joyce Henderson, the next person along, she's an advanced practice physio lead in the ambulatory children's orthopedic team. I should have, sorry about that. She's the lead at NHS Fife, very much involved with diagnosis of developmental dysplasia of the hip, and approached a number of years ago with an idea. We're going to use this AI tools, image analysis. It's going to be great. Because it took a number of years for her to be trained, and it's, how can we make this more accessible? How can we aim, she's very passionate about bringing gold standard diagnosis and treatment to newborn babies to identify them early, because the risk is, and it's been found in studies around Scotland to suggest that actually when you miss a child in that first 6 to 12 weeks, then it requires that they require surgery, which is not only expensive, but also, there's often a lot of knock-on effects of series of surgeries and pain, which could be addressed by appropriate diagnosis and early diagnosis and treatment. And so having this initial idea, talking to parents in high-tech worlds, thinking, oh yes, we could create an algorithm. By working, we managed to find, working with NVIDIA at the time, had been sponsoring and supporting a startup in Canada. So although it didn't create something new from scratch, that actually enabled us to support that, building that collaboration. And it's very much through Joyce's passion and motivation to bring together collaboration now with Canadian spin out, the academics in Alberta, and the company Echo that now has the spin out technology and algorithms to look at how to apply it and involve novice users of ultrasound devices to actually bring that into practice. So very expert, knowledgeable about that pathway, and who can work, who could you work with? Is it midwives who should be the people, or is it maybe others who are working with and doing some of the diagnosis and treatment, diagnosis early on for hearing loss, say, with newborns. So it's been a bit of a journey, but she's been very successful in getting, she was one of the first innovation fellows from CSO NHS Innovation Fellows, and has taken the project forward now as funded by MRC to sort of develop modules to enable that, to bring it into practice. So, there's lots of different ways that innovation might be, not starting from scratch and having that light bulb idea and developing from beginning to end, which patient transfer skills were. But Joyce has brought a lot of her knowledge and experience, and although she doesn't come from a research background, has been actually moved into those areas by building really strong collaborative teams as well. So third here is Stacey Boyle, showing her novel scrubs design. And I guess one thing to highlight is that successful innovators are really those people who know their solution. They understand the care pathway and can sort of identify where there's problems or gaps and what can they do better. And it actually came out of a quality improvement project that they were doing on Stacey Leeds, the elective C-section theatre at St John's Hospital, and with her manager Marianne Hay, they were trying to keep babies warm after the section, and there's a period where mum is not able to actually hold the baby. It's quite difficult after a section, and also they need to recover after that significant surgery. And they identified that, you know, maybe we could change the scrubs, and created a design working with this, you know, very much again a team approach, working with a sewing team locally to bring that together. And we've been supporting them to work with a local manufacturer who's been able to come and create the patterns so it can be manufactured more en masse. And it essentially, the scrubs has a fleecy front, which allows dads to cuddle their newborn and keep them warm, basically, really effectively in that first half hour or so while mum recovers. So it's going to be that, you know, enabling skin to skin to happen. Because dads are having to wear scrubs anyway, might as well wear something that's much more fit for purpose. And we've helped register the design for that, so we can actually have a package that we can license, that, you know, we're licensing to, or helping license to the manufacturer, which hopefully will be available pretty soon. Last example, an example of innovation to support training in a more cost-effective way. So I think there are fees training boxes which are very expensive, you know, some of the endoscopy tools. But Claire was one of a couple of speech and language therapists that were successful in an NHS Grampian competition we held with them, and to come forward with new ideas. And working with Glasgow School of Arts product design engineer Daisy Tideman and a team of third year students, they were able to create sort of boxes with games and to actually build those skills. And that's now being used to sort of enable speech and language therapists to sort of build that skill and practice it, because you don't want to be practicing and learning what am I looking for in vulnerable adults or children, as the case may be. So these are just a few examples of the many enthusiastic female healthcare professionals that we've supported. And as I say, hopefully it's either it inspires you, or you know, please do share these stories to others as well, because often it might be quite simple improvements, and these are, you know, tangible problems, but, you know, okay, some of these are high tech, but not all of them are going to be. So I'd like to now hand over to Claire. I met Claire a number of years ago, I think possibly when she was still carrying out her PhD, or shortly after that, and have seen how she's actually been the developing a tool, but also then creating the applications, most recently with Small Business Research Initiative activity in the Reducing Drug Deaths programme that was led by NHS Fife. So, you know, that I think there's looking forward to hearing more about the ups and downs, perhaps, as well, of the challenges of being an innovator in this digital health world.
Okay, thank you very much. I have started sharing my screen. Can you see it? Okay, great. Okay, so what I thought I would do today is I'll just kind of go through an overview of our products, and then kind of tell you the story about how they came about, because that's very much my kind of entrepreneurial journey. To kind of start with, I would say I never in a million years imagined myself running a company. I thought I would be a psychologist, and that's it. So how this all got started was while I was doing my PhD in clinical psychology at the University of Edinburgh. So for my research, I developed this platform called eMoodie Labs, and it delivers this research methodology called Ecological Momentary Assessment or experience sampling. And there were some tools that were out there, but they left a lot to be desired in terms of design. And we knew that kind of participant compliance was a huge issue. So I decided to design a platform from scratch. Now, as soon as we put the platform out onto the Apple Store and Google Play, I started getting emails from around the world from researchers that wanted to use the platform. And so I said to them, well, sure, if you want to pay me. So that's kind of how this began. It was very much by accident. We created the platform and I thought it would just be for my PhD, but we found that, it was useful for other researchers and clinicians. So there was a lot of background work to get this running, but those were kind of the seeds for what became the company. So in this original kind of project to build the platform, I was in touch with the informatics department at my university, and I found a master's student in artificial intelligence, and he's currently the CTO of the company. I also needed to find a designer in order to do the graphic design for the app. So I contacted the Edinburgh College of Art and I put out a project spec and asked for volunteers. And Sylvia was the graphic designer for the project, and she's now working for the company as the creative director. So we had this very early team and we grew together over the years. So during the pandemic, my PhD was very much put on pause. And so it was at that point that I decided to take things forward and incorporate the company. And from that, we decided to start building a mental health platform. I really saw that there was a gap in the mental health apps and digital mental health platforms that were available at the time. One of the main things that we focused on is utilizing AI in order to screen for people's symptoms and also what we would call psychological markers of mental health. And as part of the screening technology, it then enables us to provide more targeted and tailored interventions and exercises for individuals. So currently, the vast majority of mental health apps and platforms on the market, they're completely generic in that people download them, they sign on, and what content and what exercises they engage with is totally self-directed. Whereas here, we're getting to the point where we can actually recommend the exercises that are going to be of the most benefit to that person on that given day. Later, and more recently, we did a project in collaboration with the University of Edinburgh, where we took our core screening technology that was only applied to mental health at that point, and we expanded it into to address the problem of drug overdose deaths. So the University of Edinburgh had developed a wearable, and in collaboration with them, we adapted the wearable to screen for a variety of biomarkers that are indicative of of risk of drug overdose. And so the wearable then communicates with the platform and alerts a pre-appointed emergency contact so that hopefully that person can locate the individual and call 999 if there is an emergency and thus prevent a drug overdose death. But in addition to kind of this time window of really, really high risk, we also expanded it so that the person can access recovery-based tools through the mental health platform, and also that it integrates our screening algorithms. And so the eventual kind of plan would be that we could screen for when an individual is declining in terms of their mental well-being. And so that same alert system can then provide a prompt to their support contact and hopefully be able to reach out and prevent a high risk situation entirely. So across across these various products, it's really just two core technologies of the software platform and the screening algorithms, but they have different applications in different settings. And the reason that that's important is because then you look to the wider kind of market of where this can be applied. And, the getting into the NHS specifically, that's a long road. And so, it might be that your innovation really can only be in a healthcare setting. But if you can think wider than that, to the third sector, for example, in our case, we built the mental health platform to also have applicability to address workplace mental health so that we can sell to organizations. And just taking that wider picture in order to have a little bit of diversification, because the road into the NHS is a long one. And so if you're able to figure out another place or another market that your innovation could sit, while you're going through the long road of clinical validation and whatnot, that's a strategy that we've taken and has served us well. So what I thought I would do is go through kind of some of the early stage steps that I took, because as I mentioned earlier, I never imagined I would become an entrepreneur. And it was really the resources that were available within Scotland and specifically within the university that I kind of took hold of. And it was with those resources that I was able to take an idea and actually drive it forward into a company. So one thing that's present in a lot of universities is they typically have an entrepreneurial arm to the university. So in my case, the University of Edinburgh, they have a department called Edinburgh Innovations. And so there they had the ability to sign up for a drop-in hours. And I was able to get advice in order to be able to negotiate my intellectual property away from the university. So we are not a university spinout as a result of that early advice and someone walking me through the steps in order to secure my intellectual property. So from there, we were able to get a business advisor through Edinburgh Innovations, and she was constantly sending me, competitions, startup initiatives, and it was through that kind of system that I began to go to events, and by attending those events and participating in various competitions, that's kind of how an idea became the company effectively. So within Scotland, there's a number of things that I would point out. One is Scottish Edge, and that's a formal competition, but it gears itself towards different stages, whether you're incorporated or not. Another one was Converge. It's called the Converge Challenge. That one was really, really beneficial. They did a 3-day business boot camp effectively. And gave me just a whole overview of all of the things that I needed to think about as I was seeking to incorporate the company. Another organization is called Data Lab. It's funded by the Scottish government, and their kind of remit is to bring data science funding and skills home to Scotland. And so, for example, Data Lab advised us as we were applying for one of our first big research and development grants, and they went through and gave us the feedback so that we were able to be successful on that grant applications or on that grant application. So there's lots of different resources out there. You just need to, sign up to mailing lists, and you need to search and put yourself out there. Another thing I would say is if you can find yourself a mentor or advisor early in the early stages, that can be really make the difference as you're going through, because there's a lot of decisions to be made, and to be able to call in someone who really has that expertise to get that advice is just invaluable. So Barclays is one that is UK wide, and they have a whole range of mentors across lots of different specialities. One that I benefited from is called Microsoft Azure for Startups. So it's a program where you can get free cloud credits. But as part of that program, I was able to get a mentor, and he was, a Microsoft employee, and he talked to me once a week for 3 months. And so, the amount of knowledge and expertise that he imparted to me in the early stages was just really, really wonderful. And so there is, you can get access to expertise. And when you are in your early stages, people are pretty good about wanting to help you out. You just need to ask. And the worst thing that happens is someone says no. But if you're operating in a particular area and experts in the field, you can contact them, and the worst thing that will happen is they're not available. But a lot of people, if you just reach out and explain what you're, you need a 30-minute call, many people will respond. So another thing that I would point out in the early stages that I did was I really relied on university students. So I mentioned kind of earlier, as we were developing eMoodie labs, I emailed or went in person to meet the secretary of a particular department and asked them if they would put the email out to their student body within that department. And that's how I was able to find a tech person, a design person, and recruit a bunch of honorary research assistants for my own PhD project. But we've continued, in that vein. So, for example, we host industrial placements for MSc students within the company, and you can. There's a lot of people who are want to get experience, and if you outline kind of a project spec, skills that they'll obtain as a result of volunteering their time, and maybe promise a reference letter at the end, you can get quite a lot from that, and it's a benefit to them as well. Now, while you're in the early stages, money is very tight, but it is really important to put the appropriate legal contracts in place. So even, for example, with interns, honorary research assistants, I always had people on contracts. And the reason being is that if you're doing something in tech and in innovation, you need to protect your IP. And so, you don't need to do something in terms of getting a lawyer to write this from you or write this for you. There's a lot of legal templates that are available online. So what I did was downloaded legal templates and then edited them to the best of my ability. And those served as like the early contracts as we were getting going. And I can't impress upon you enough that, protecting your intellectual property from day one is super, super important, because if you make a mistake in that area, that could be really detrimental later on. The other thing I wanted to touch on is the issue of kind of, how do you find co-founders or early team members to help you out, and what should you look for? You're not trying to find someone who's exactly like you or has your skill set. You're trying to find people that are complementary to you. So some people ask me about, well, how do you feel about being a non-technical founder? Because I trust my CTO and have this relationship, going back all these years with him, I haven't found that to be a detriment, because in the context of our particular innovation, my clinical knowledge is really, really important. So you can't have everything and you can't be all things, but examining what skill sets you lack and finding them in other people is really, really critical. So I'll tell you quickly the story of our CFO. His name is Johannes. He was a financial analyst at one point and decided to become a psychotherapist. And so he was doing his studies at the University of Edinburgh to do this career change. And he was working for me as an honorary research assistant. And I happened to attend an event that was put on by Edinburgh Innovations. It was called 3-Day Startup. So it's kind of, you develop a startup over the course of a weekend. And he attended too. We didn't talk about it ahead of time. He was in the room. And so for that event, you kind of, people had to pitch their ideas, and then some ideas were selected, and then as a result of which you formed teams and then developed kind of a business canvas over the weekend, and then pitched to judges and got feedback at the end of the 3-day event. And so he chose to work on my team. I didn't ask him, didn't force him. But over the course of that weekend, I saw how much business acumen and financial knowledge he had. And so at the end of the weekend, we had already been working together, but I said to him, I said, look, I'm thinking about incorporating this company, and you clearly have this, really wonderful skill set, would you be interested? And so he's now become our CFO, and his financial knowledge has been, absolutely essential as we write grants and operate the company. So that's just a really good example of kind of a natural way that we met, and it just occurred to me, wow, this could really work, and I just kind of went with it. You have to be aligned on mission. In this particular space of healthcare, I think that it's an easy one to be aligned with, because it's very much a values-based approach. And so when you have that alignment on a shared mission, that can get you through a lot of the challenges that come along the way. And the final thing that I would point to, and maybe because I'm a psychologist, I would highlight this, is that when you are looking at your founding team, you want people that have different personalities on the team, so that that your personality is not mirrored in them, and because your different personalities will mean that you approach problem solving in a different way, and that can be really, really beneficial as you're going through the early stages. And last but not least, I would say, just in general, if you're going to kind of go through this innovation journey, you have to be an individual that is comfortable with entertaining a high degree of uncertainty at all times. And so if that doesn't really sound like you as a, in terms of your personality, that's something to really think about, because it is, you really have to keep pushing through a lot of adversity in order to be successful in the end. So that's all I had for now, and I think I'm much over time. I'll just put a quick plug out there. We are always looking for testers for our mental health app. So if you're willing to help us out on that, that would be great. And otherwise, I will pass back over, and I'm willing to answer any questions that anyone might have.
Frances might have a couple.
Yeah, no, a lot of people saying, really interesting. Claire Ann, I mean, it's quite funny, because I think as a female as well, I was thinking, oh my goodness, do you think that because we're females, we're okay, like asking questions? You were speaking about don't be frightened to ask. And I think that maybe is like some of the key, things to take on, that when you don't know, just ask somebody. There will be somebody to help. And you've obviously had that in your experience yourself. So interesting.
Yeah, I generally say that doing a PhD was a really good training for being a CEO, because a lot of the problem solving that you do while doing a PhD and project management and various other skills are directly transferable to this. But you do have to make lots of decisions, and so you have to kind of figure out the decisions that you're going to make, because you need to be fast, and you can't be asking for help all the time. But to have that trusted advisor or mentor for the times of great uncertainty, or when it's something that's completely out of scope, or when you're out of your depth, that's really important to have. So. So, for example, in that case, there was a funding scheme where it was called Fast Track Executive, and you got funding to hire or to bring in someone who was an expert in your area in particular, and help you develop a business plan. And so our advisor, his name's Clive Flashman, he was, really, really well situated within the health tech space. And he's been with me ever since. So whenever I have a really big problem, I call Clive. So
just someone as well is asking, what was the evidence that you used to base your design around? Just wondering what evidence, like the design for the app, was based around. Lived experience, I guess. I don't know, but on you go. Sorry, I'm answering the question.
Yeah, so there's a few parts of that. The data that I collected as part of my PhD, that was the data that was used to develop our screening algorithms. So after I collected the data, I realized that some of the data that I collected, it would require someone to know machine learning in order to be able to analyze it. And I said, there's no way I'm learning machine learning, or there's no way I'm taking that on. So I went to the School of Informatics. I outlined a couple of master's projects, and I put it out there, and a number of or a few students took up the projects and did the analysis, or did the analyses that I wasn't able to myself. And then that was the basis for our screening algorithms at the beginning. Like, that was the initial evidence. In terms of the mental health app, we really looked at what are the evidence-based digital interventions for common mental health problems. And then we did a lot of design work to bring those over from the evidence base and integrate them into the app.
Yeah, they were apologising there, that person, saying, talking about the, the formatting and the design and that, and also saying that machine learning is such fun. I don't know if it's fun or it's just complicated, but anyway, yeah, they accidentally dipped in, so that's interesting.
The design was done by, I've had this graphic designer throughout, as part of this whole journey, and so I've been working with her for so long, and so as we developed the mental health app, she is the one that brought all of these ideas into into the format and whatnot that you currently see them in.
And interesting, some questions coming in about being a female in this world as well, and how difficult it is really to kind of balance your own ambitions, work-life balance, barriers, responsibilities, that type of thing. Just wondering how you managed to do that. That's a massive question I've just asked you.
So, you again, kind of going back to that thing that I was talking about, personality. My training is in, psychology. So I was trained to be super empathic. So, I struggle with negotiation, for example.
Yeah.
But, playing to my strengths, one of the consistent feedback that we have when we do exit interviews for people that are leaving the team, they always say to me, this was one of the best teams that I've ever worked with. So, one of the strengths that I've had is been able to build and maintain a really, really wonderful team because of my background and skill set. And so, getting people to work hard because we have a shared mission and because we want to do good in the world. That's a really powerful motivator, and it's better than hounding someone because you're, you have to look at what your skill set is, and in this case, motivation and mission, that can be really powerful in a workplace too. So.
Oh, definitely.
Yeah.
Well, lots of just, thank you. What a great journey. Can I ask Claire, is she supporting or mentoring? And if so, what platform? So they want you to mentor them, Claire, so it's went well.
So I'm not formally doing that, but feel free to add me on LinkedIn, and if you want to reach out, I'm happy to have a chat. We do have an internship program, so
another plug.
So that's one thing. So there you go.
Okay.
But in terms of particularly for female innovators, there's one program here in Scotland. It's called Accelerate Her, and I know that they specifically have a mentoring program there. So yeah.
No good. Just conscious of time, so yeah, no thanks. Very, very interesting. I could talk all day, but we'll do that offline.
So really feel free to reach out and ask any questions that you might have if you'd like. But there's really lots of resources available in the UK, but Scotland, one of Scotland's benefits is the fact that it's small. So it's once you figure out how to access some of these communities. So for example, the Converge Challenge, then there was all of these early stage businesses that we were connected to, and so if you're having a problem or and whatnot, you could reach out to one of your former competitors, because you just create this kind of, or these communities are naturally created out of need and necessity. So yeah.
That's great. So I slightly preemptively shared my screen just to do a bit of kind of rounding up, because so I mean, you've managed to obviously a number of the ways that you found, you literally knocked on doors to find students to work with you, and obviously you do placements and things like that. And just for other people on the call, there is an organisation called Interface, slightly biased because I worked there for a number of years, which is the aim of which is to actually sort of shortcut that process, make it a bit easier and manage. So if you don't really know where to go or what to do, and they help, you can actually sort of hone that brief of what is it, the problem, where's your gap in expertise, certainly. And they work with a lot of startups and SMEs. So, they're very much about finding academic expertise, but it also includes finding students, for student placements, because a lot of courses they're absolutely dying to have practical experience in the real world, and that's obviously, it comes as standard in a lot of clinical training, but in terms of that business experience as well. So I just wanted to sort of round up by thanking everybody for their questions. I think we could continue this chat for a lot longer. We're trying to concentrate this into into everyone's lunch hours. I think there were a couple of other comments about how to get in touch, so we could link you in with Claire Ann afterwards. I think one in terms of looking for sort of collaborations with the NHS, and we can certainly make sure that facilitate those introductions, as I'm sure Claire Ann be keen to speak to people if you haven't met her.
There's my email. I just put it in the chat, so feel free to get in touch. But you can also find me on LinkedIn.
Yeah, great. So we currently have an early stage innovator call. As I said, we're now open to engage with not just NHS staff, but also those of you in this call, particularly looking at kind of that early stage of an idea, or if you're early on in your career, sort of going to sort of help sort of link you in. And that might be kind of giving some of the examples and making sure that you are connected to the wonderful innovation ecosystem and medtech ecosystem that there is in Scotland. So that's something that feel free to find out more on our website. It's relatively simple. It's more about helping you sort of think through your idea. It's not a funding call in that sense. So it's very much a simple submit on our website. And this has been recorded, so do share the recording and links with your colleagues. For anybody who would like to hear from Claire Ann, who wasn't here today, and there's obviously past webinars that are recorded on there too. If you'd like to chat to us, myself, Frances, then you can book a call on our website as well, essentially, thank you very much thanks again to, Claire Ann for joining and sharing her journey. Always, I think, and giving those little insights of actually there's a world of things that you need to think about, but there's people out there who can support you and help you take those steps and work things through. There's a number of accelerators as well, and different opportunities which can kind of help fund some of those early stages as well. If you're not connected to us, we're on various social media platforms, obviously on LinkedIn, and if you can sign up to our newsletter to hear about the next webinar and other things. But I wanted to just say finally thanks to everybody, and look forward to seeing you at our future webinar.
Thanks all.